The Vatican says Pope Francis has developed pneumonia in both of his lungs. The Catholic Church said tests also revealed he has asthmatic bronchitis. The respiratory infection requires the use of an antibiotic treatment. A spokesperson for the Vatican says the 88-year-old is in good spirits. He was admitted to hospital on Friday. All of his public events have been canceled through Sunday. To unpack the complexity of the Pope's health situation, let's bring in Dr. Indeveer Mahal. Dr. Mahal is a family physician and a health journalist, so we are literally and figuratively very far away from the Pope here, so we get little bits and pieces of information from the Vatican. Based on those bits and pieces of information, what can you tell us about what appears to be his health situation?
Yeah, so Pope Francis, of course, is 88 years old. He's had a history of partial removal of a previous lung. We call that a partial lobectomy. So for someone of Pope Francis's age, previous medical issues, he is more predisposed to developing pneumonias, bronchitis, and complications from those. So everything that we hear from the Vatican is quite in line with what we'd expect of someone of his age and his comorbidities. So it's not that surprising that he's needed to be hospitalized and is taking a break from his duties.
The Vatican says his respiratory infection continues to present a complex picture. That's the description they use. That doesn't surprise you, that language?
No, it doesn't. So complexity can mean a couple different things when it comes to pneumonias. We talk about complexity when something is harder to treat or takes a longer time for it to resolve. So in the Vatican's case, we know with that partial lobectomy, we know with this age, he's more likely to develop complications from pneumonia like pleural effusions, which is fluid around the lungs. He's more likely to develop an abscess, which is an infection secondary to the pneumonia itself. And then we also know that the Vatican has stated he has a polymicrobial infection. So perhaps multiple bacteria, viruses, possibly even fungal involvement, and that means multiple antibiotics, multiple viral and fungal treatments, and more likely to have treatment-resistant pneumonia as well.
Yeah, so that's interesting, treatment-resistant pneumonia. I think for a lot of us, we think if we have an infection and we get diagnosed and prescribed antibiotics, things clear up, it's great. 3-4 weeks later, we feel terrific. But is it because of his age that he's facing these challenges that can't easily or necessarily be cured by antibiotics? Or is it the things that he's infected with, or a combination of those things?
It's a combination, Ian. So, you know, when you're older, you have a lower reserve. And then on top of that, when you're missing part of your lung, your reserve is even lower. So your baseline respiratory function is not the same as someone who is 40 and has both lungs complete. So your likelihood to develop a complication is higher. But at the same time, we also see 40 and 50-year-olds who come in with really complex pneumonias because the bug that they've gotten is harder to treat as well. So things like MRSA or methicillin-resistant Staph aureus, Pseudomonas, COVID, of course, those are harder infections to fight, and our antibiotics and our best treatments can't always do the job that we want them to do. So in those cases, we do see prolonged recoveries and we see longer hospitalizations.
So presumably he's getting the best care that you can get at the Vatican or in Rome. He's getting the best access to antibiotics that anyone could get. And with all of that, we're hearing that he has been prescribed, or it's been recommended to him to have complete rest. Also, yeah. I think that wouldn't surprise you.
It wouldn't surprise me. And if you think of yourself, Ian, how you feel when you have a flu or even a viral infection and a cold, you don't feel like going to work, you want to rest, you need a week or two sometimes to recover. So again, if you look at someone like Pope Francis, again, his age, his medical issues, it's right on par with what we would expect for anybody to have a pneumonia, to be resting and taking their time before they go back to their duties.
And again, there's no way that any of us, including you as a doctor, can really have a sense of how he's doing from afar. But what are you looking for in terms of what would be a sign to you that things are on the upswing?
Yeah, so the Vatican has sort of already hinted at some of the things that he's doing well. He's taking meetings, he's taking phone calls, he's doing some reading, he's up and talking. So all of those things tell us that from a respiratory perspective, he's stable, he's able to engage in his activities, and all of the things put together, I think, are a really positive sign.
Fantastic having you on the program. Hopefully we can have more of these chats on the future on more pleasant topics.
Nice to see you too.
All right. Family physician Dr. Indeveer Mahal.